Prostate cancer is cancer that occurs in the prostate, which is a small walnut-shaped gland in the male reproductive system that produces the seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer. Many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer that is more advanced may cause signs and symptoms such as trouble urinating, decreased force in the stream of urine, blood in the urine, blood in the semen, bone pain, losing weight without trying, erectile dysfunction, and so many others. Prostate cancer that is detected early, when it's still confined to the prostate gland, has the best chance for successful treatment. Today, on your regular health TV talk show, the physicians will be discussing prostate cancer, what you need to know. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, the regular anchor on this program. Today we're discussing prostate cancer, what you need to know. And with me, as usual, I'm not always alone. I always have my very cerebral, I call her the celebratory string. She's no other person than...
I'm Dr. Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
And will always be our business.
Our business.
We're talking about prostate cancer.
Nightmare for men.
Yes, nightmare for men.
I'm beginning to see younger men with prostate cancer, though I'm not in that field. The reason why I've got to see younger men was because of they had psychological issues, and being a psychiatrist, they needed my intervention on what to do. This young man was just, it was not up to 50. It's when you're not up to 50 in the world now, you are young.
Yeah.
And you are young, like young. And if you see this man, he was looking like a 32-year-old, like literally fit, all those mince and bone, kind of 6 feet tall, dark, 6 packs, kind of thing. And then all of a sudden they're like, he lost it, like literally, and he is a boss in a big corporation, and he just felt that why would they say he has prostate cancer?
Okay, so I need to get something very clear. Was it because they told him the diagnosis of having prostate cancer that made him become a patient?
The diagnosis alone, the first thing about when people hear cancer, death. People link cancer with death. They don't look at the fact that you have the prognosis, when treatment, intervention, early intervention, treatment, all those things could lead to
the cancer to death. So that is like a myth.
Yes.
We'll try and get a consultant to come and talk about that myth, cancer and death.
Yeah.
Okay. Well, unfortunately, we don't have so much time to discuss this. We're going to talk about seeing younger people now with prostate cancer. Is it because of technology that they are beginning to see them, or early presentation, or the awareness is increasing?
We have a guest now.
Well, we'll be back after the short break. Just go and call all your friends. Pick up that phone and call them. Call your family members that it is time for the physicians. You can't miss the physicians. It's your daily tonic. It's your weekly tonic. We'll be back after the short break. Stay tuned. Health TV talk show, The Physicians, where your health is our business. Today we're discussing prostate cancer, what you need to know. And with me in the studio, I call her small but mighty. She is no other person than our consultant oncologist, Dr. Chinenye Iwuji. She is from Lakeshore Medical Center. Dr. Iwuji, you're welcome to our program. Finally, I'm excited. I really am. Yes, maybe you should help me to just thank in advance. You have no idea how it took me
to bring her on board as
our guest here. I got to know that there are just about 60 or 90 oncologists in
Nigeria. Yeah.
So you can see her time is actually very, very limited.
You're welcome.
But as usual, on our physicians, we always promise to bring the best.
Of the best.
We brought Dr. Iwuji. Dr. Iwuji, you're going to come to our program.
Thank you so much for having me. It's a pleasure to be here.
Thank you.
Yeah.
So talking about prostate cancer, maybe if I for let our viewers know, what is a prostate?
Good question. Let's start at the beginning, right?
Yeah.
So the prostate is basically a gland in the male reproductive system. It actually helps keep the sperm healthy. Okay, so it's like a little walnut-shaped gland that is just behind the rectum and the male reproductive system, and it keeps that semen healthy. So that's why when a lot of men have issues with the prostate, it has a big impact on them because it can affect things like, you know, their urinary function, their sexual function, and even the treatments can affect that as well. So that's why when we're talking about the impact it can have on men, both physically and psychologically, it can be a big deal.
Okay, so that is the prostate. Yeah. So now talking about it, so what is it? What is prostate cancer? Obviously cancer that is in the prostate. So how does this really start?
Okay, so all the cells in the body basically have a life cycle where they get born, they specialize to become a prostate cell, a lung cell, a stomach cell, and then they die. So if in your prostate you get a cancer, what's happening is your cells are dividing very, very, very quickly. And instead of them going through that life cycle and dying, they continue to grow and replicate, and then they start spreading to other parts of the body, and then they start causing damage to other parts of the body because they're not controlled. So that's what happens when you have prostate cancer. Yes.
This is quite interesting. So how common is prostate cancer? And of course, which groups are more at risk of having prostate cancer?
Okay, so prostate cancer is actually very common. It's one of the top 4 cancers we have in Nigeria, and it's actually the most common cancer we have for men as well. And the issue we have, particularly in our environment, is actually that compared to the Caucasian population or the West, in those populations, they get prostate cancer at a later age. In like the average age is in between your 70s, 70 to 75. But in our population, we see young men getting it. We see men getting prostate cancer at the age of 40, 45.
It's alarming.
It is alarming. And 1 in 4 black men will be affected by prostate cancer. So compared to our Caucasian counterparts, we get prostate cancer almost, let's say, close to twice as frequently as they do. Close to. Yeah. And then compared to the Asians, they have the lowest rate of prostate cancer. So really in our African black population, we get it younger and we get it more frequently.
You get it younger and more frequently. That actually is the rate a lot.
Yes.
So what are the possible risk factors and possible causes?
Okay, so some of the risk factors can be genetic. So it's like in some families, they will have a family history of prostate cancer. So if you know you have a family history of prostate cancer, or if you have relatives, female relatives with breast cancer, you should also get yourself screened for prostate cancer, because that means that you might have a genetic predisposition that will put you at a higher risk of developing the prostate cancer. Then there's things that we have more control about, like our lifestyle, you know, diet, exercise. Those things are extremely important. You know, doing things like not smoking, because we all know that smoking is a risk factor for cancer. So not smoking is very important, and having a diet that is, you know, low in fat, low in processed food, high in vegetables. Those sort of things can really help, and exercising can definitely reduce the risk of cancers in general. So prostate cancer specifically as well. Yes.
So
it's getting quite scary.
The risk is that you have just talked about exercise, lack of exercise, smoking, tobacco,
and high alcohol intake as well. High alcohol intake. And I want to just emphasize this. The amount of alcohol we're supposed to drink per week is 14 units. What is 14 units?
Exactly.
14 units is 7 glasses of wine, not in one night, okay? Over the duration of the week.
7 days,
yes. Over the duration of the 7 days.
Glasses.
No, 7 glasses.
And glasses like in normal regular glass, not the big jar.
The one that you have to
yes, glass, yes.
Exactly, and or 7 pints of beer. Okay, so again, normal pints, not a Nigerian Giants, you know, bottle. So normal 7 pints over the 7 days. So that gives you an idea of what we should actually, you know, men should actually be consuming in terms of alcohol. And then the other thing that helps, of course, is screening. okay? So if, like I mentioned before, you have a family who have a history of cancers, particularly prostate cancer, breast cancer in women, but even if you do not have that family history, all our men should start doing their screening for prostate cancer from the age of 40.
Awesome.
From the age of 40.
And I think that is just it, because our viewers are likely going to say, okay, she has mentioned screening 2-3 times now. At what age? So from the age of 40,
yes.
And if you have health insurance, best for you, because out-of-pocket payment is really, really, more expensive. Now we've talked about what prostate is, what prostate cancer is, risk factors. What are the common presentation, like the symptoms you get to see here and globally? And why is it that sometimes people don't present with symptoms, known symptoms at the early stage, what we call in medicine asymptomatic, like they are not symptomatic, they don't show any sign at the early stages? Why is it that sometimes?
Okay, good question. So the common symptoms we have for prostate cancer would be things like difficulty passing urine. Okay, so you notice that you have your normal stream of urine, but suddenly you need to go, but when you pass, it's only a small amount, or it comes out very slowly. That can be one symptom. Or you find that you're going very, very frequently, particularly at night. So if a man suddenly starts passing urine more than 3, 4, 5 times at night, that can be a sign as well. Difficulty with sexual activity. So your libido goes down, you're struggling to ejaculate when you're having sexual intercourse. That can be another sign. And the important one is back pain. A number of men have back pain, and that is how the prostate cancer presents. Why? Exactly. Because if you have prostate cancer, one of the first places it spreads to is the bones, and particularly the bones in the lower back, the spine. And so a lot of men will present to like accident and emergency or their general practitioner with back pain. And then when we investigate that back pain, we find that it's actually prostate cancer that has spread to the bone. Okay, so it doesn't mean all men with back pain have prostate cancer, but if you have persistent back pain, you've gone to the doctor, you've gone to the GP, you've had physiotherapy, and you're still getting this back pain, especially if it's associated with any of the other symptoms I've mentioned with, urine problems and all the rest of it, you should definitely get that investigated. And the reason why a lot of men present late is, number one, they don't take it seriously. You know what men are like now. They don't want to go to the doctor. They don't take it seriously, or it's something like back pain, so why would they be worried about it, you know?
Exactly.
So these symptoms...
Back pain anyway.
Exactly. So by the time you have a lot of really obvious symptoms and it's really distressing, chances are the cancer is more advanced. And that's why screening is so important. I keep saying it, but screening will catch the cancer when it's at an earlier stage before you have the symptoms. Because often by the time we start having these obvious symptoms, it's already spread and it's quite late in the journey.
So I need to understand something. You talked about, we're talking about cancer right now of the prostate, and that is the enlargement of the prostate.
Yes.
Is it all enlarged prostate that is cancerous?
No, it is not. So it's actually very natural for men to develop enlarged prostates with age. Okay. So, from the time you're getting 40, 50, in fact, throughout your life cycle, your prostate is actually just getting larger and larger and larger. So when men hit, 60, 70, 80, they often have enlarged prostates that are not cancerous at all. Those ones can be dealt with, medication, minor procedures can deal with it. So it's not necessarily cancerous just because your prostate is enlarged. It's just when you have these additional symptoms with it, or if you have abnormal blood tests, for example, your PSA, which is a blood test that can be done to screen for prostate cancer, if we notice that that is high, then we need to investigate further with a biopsy and see if that enlargement is because of a cancer or whether it's just the normal enlargement that happens to all men.
Okay. So now you talked about the PSA. That is one of the methods that is used in diagnosing the prostate cancer, right? I want to also understand, for individuals that are diabetic, is there any link? Because remember you talked about waking 3-4 times at night to pass urine. Because I know our audience that are watching, probably the diabetic patients that usually have challenges of going also on diuretics that go to use the bathroom at night. Maybe something's going on in their mind now. Is it possible that that is a prostate cancer that I have?
Yes.
And is there any link?
So, yes and no. So on the one hand, if you normally have your normal routine, and because you have diabetes, you already know that you pass urine quite frequently at night, and suddenly it changes. It's that change that would ring the alarm bell. That's the first thing. The second thing is there is a bit of a link with how your body manages its sugar levels and people developing prostate cancer. Now let me clarify this. I am not saying that you should not eat sugar because it causes cancer. I'm saying that if you have excessive sugar and your body can't manage it, it can put you more at risk of developing prostate cancer, and that's a separate thing. But for people who are diabetic, if you know that because of your diabetes, for the past 10 years since you've been diagnosed with diabetes, this is how frequently you go to the bathroom, and suddenly that changes and increases, it's that change that's the alarm bell, not just because you normally pass a lot of urine.
So how is the diagnosis made?
So, the diagnosis for prostate cancer is made by, initially, you might notice any of these symptoms. You go and see your doctor. They would examine you, investigate. So they'll do a clinical examination where they'll find that the prostate can be enlarged. Then they will do imaging. So they can do a scan, MRI scan, bone scan, CT scan, depending on what modality you have. And if they see a sinister enlargement, they will do a biopsy. The biopsy is very important. That's when they take a sample from the prostate to see if it looks cancerous under the microscope, and then based on that, they make the diagnosis. So all these steps are very essential in diagnosing the prostate cancer.
Wow.
And I think at this point, it's good for us to know, because it's prostate cancer, right? What are the stages, of prostate cancer, and the fact that you made mention of the prostate-specific antigen. What role does it play in prostate cancer diagnosis?
So, first of all, the prostate-specific antigen is a blood test that can be used to diagnose prostate cancer and can also be used to screen for prostate cancer. So I've been saying screening, just to clarify. So when you do the prostate cancer screening, it's basically an examination where they do have to examine from the gentleman's rectum, back passage, to feel what the prostate feels like, whether it's enlarged or not. And then they can also do a blood test, simple blood test, nothing complicated, not surgery or anything. A blood test where they look at the levels of this PSA, prostate-specific antigen, in the blood. So that's how they can diagnose the prostate cancer, or even screen for prostate cancer if it is enlarged. I'm sorry, I forgot the other question. The stages, thank you. So the stages are very important. So to cut a long story short, prostate cancer, you can survive from it very easily. And stage 1, stage 2, stage 3 means that the prostate cancer is confined. So it's just in a set place, and you can easily treat it with surgery or radiotherapy. It's when it gets to stage 4 that it's actually started spreading beyond the prostate. It's gone to the bones or the liver or the lungs. And that's when it becomes a bit more tricky to manage. But you can still survive even when it's spread to those stages. So that's really important. Yes.
Yeah, and I think that kind of just cemented the discussion we had earlier on with regards to the young man I saw, just losing it, and then we later found out that there was a familiar history. It wasn't like directly from the dad, it was from the dad's brother who concealed it. Nobody knew the cause of his death. So this is why, families must have conversation, and it's good for us, like just what you just said now. If there's a familiar history, just take it step backward. 35 years is not too bad. So now, what are the primary treatment options for patients with cancer, and how can they be treated based on the stage and the patient's health?
Okay, so we have various treatment options, as you've alluded to. You can have some patients, if we catch it nice and early, they might even not need active treatment. Nice and early, because if we catch it at that stage, they might not even need treatment. Some patients have prostate cancer that we catch at such an early stage, we just monitor them regularly and keep an eye on them. But for other patients, you have what we call localized treatment, which would be surgery or radiotherapy. In some cases, we give them hormone treatments because the cancer is being driven by your male hormones, testosterone, right? So what we do is basically suppress that hormone as a means of reducing the feeding of the cancer. So the testosterone is feeding the cancer. We block the testosterone. It stops feeding the cancer. The cancer is controlled and regresses. So you can use testosterone to control it, but if the cancer has spread and we're struggling to control it and it's too advanced for surgery or radiotherapy, then we can aim to do chemotherapy as well. So those are the different classes of treatments we can use: surgery, radiotherapy, chemotherapy, hormone therapy, and sometimes just monitoring the patient.
Okay. Dr. Before we go to talking about the preventive measures, okay, because you just made mention of the cancer being driven by the level of testosterone, right? So, because there was this guy who came, he said he had cancer, prostate cancer, But he said he's aware that the testosterone is actually a major factor, and that he believes that as he ages, testosterone level comes down, the cancer will.
Is that a myth or a fact?
It's not your natural. So the levels of testosterone we need to drop to are really low, like almost to zero. So when we are giving these hormone treatments, when we do surgery, we then go back and check the testosterone level, and we're aiming for it to be really less than 1. Okay, so with natural aging, your testosterone actually doesn't drop that much. We really have to intervene with something surgical or radiotherapy or hormone therapy. It wouldn't just happen on its own. So I'm afraid that is a myth.
Anyway, we'll talk about the myth sometimes. So let's talk about the preventive measures. What are the ways this can be prevented apart from the screening?
Okay, so the preventative measures are things that I spoke about in terms of a regular exercise, a healthy diet that they should have as well. I know I keep saying screening, but other than that, it's just monitoring yourself, keeping yourself healthy. And if you see any of those issues, you know, the urinary frequency going up, waking up a lot in the night, catching it early. Because if we catch prostate cancer at stage 1, stage 2, and even sometimes stage 3, the cure rate, not the treatment rate, the cure rate can be as high as 98, 99%. So actually, prostate cancer can be very curable. The problem we have is that we catch it so late, particularly in our environment, and that's what reduces the survival rates that we see in Nigeria.
How about the kind of food that we take?
So lots of vegetables, reduce processed foods. So things like, you know, shawarma and packaged foods and tinned meats, reduce those. Make sure reduce the canned food. You can have protein in your diet, but just try and balance the protein and the carbohydrates, and try and reduce fizzy drinks, reduce alcohol, and like I said before, exclude smoking.
Tomatoes, does tomatoes have any special?
Tomatoes are good, actually. Tomatoes are medicinal, so it's good to, the more tomatoes you have in your diet, the better. It is particularly good for prostate cancer. Thank you for remembering that.
I read somewhere that even a tomato that is a bit that is not so fresh.
Exactly.
That is best for people.
Yes, it's true. A lot of tomatoes, and like you said, the ones that are not so fresh, they're actually very, very good for reducing the risk of prostate cancer.
Dr. Iwuji, I think I will not go away without asking this question. How do you relate the male sexual activities to the prostate cancer?
Thank you for asking that, because I get asked that a lot. There really isn't a link. I'm so sorry. I'm going to become a bad guy. There really isn't a link to the men's sexual activity versus the risk of prostate cancer.
Really?
So men, yes, there isn't.
That's
It's a myth.
How do we say, oh, I have a prostate? It's not affecting my libido.
Yes.
So the level of, if you're very highly active or not very active, that doesn't put you at risk of developing prostate cancer, okay? It really doesn't. It's just that if you have prostate cancer, you might notice your libido going down.
No, they said you have to have sex 21 times a month before. Yes,
let
us say that it is. No, because we are the experts here. It has been, people know there's that whole notion that if you don't have sex 21 times a month, you have
because the sperm, the semen will be more.
Yes, and to accumulate.
It's accumulated, so it's baggy and you now have prostate cancer.
Wow, no. That is, I'm sorry, that is a myth. Please, they can have as much sexual activity as they want, but it's not really preventing the prostate cancer. There is no data for that. I have looked into it because I've been asked this question so many times, and I cannot.
I think it's a good But again, before we go, please, can you just tell us, how does active surveillance differ from other treatment approaches, and when is it recommended?
Okay, so if we catch the prostate cancer at a very early stage where it's very small, it's only affecting the prostate, and it's not at risk of being, spreading to other parts of the body, that's when you can do active surveillance. But if it has started spreading, or it looks like it's going to be a bit more aggressive or high grade, that's when we would say, let's do something to control it so it doesn't spread and start causing issues.
Dr. Iwuji, it's not easy bringing you here, so I want to just, maybe just some words to advice to people out there.
Thank you. So first and foremost, I want to emphasize cancer is not a death sentence. For men, please get your prostate cancer screening from age 40 once a year. It's a simple blood test and a rectal examination. Very, very simple, cost effective. It's so important. Thank you so much.
Thank you very much for coming on our program. You've heard it all that she has said. Exercise regularly, good diet. Please, you have heard her say it. It has nothing to do with your erectile dysfunction. that the fact that the prostate is enlarged does not mean that you have cancer. You can have an enlarged prostate, it can be benign, which is normal. You can have the one that is cancerous. You already heard the signs. Difficulty in passing urine. Then you also have what we call the stop-start phenomenon. You pass the urine, if you stop, you come back. All these ones are coming up because the prostate is enlarged and encroaching on the pipe where the urine passes. Then if you're waking up so many times at night, all you just need to do, you just go and see a doctor. Don't go on the internet all the time and Googling all these things and getting scared of cancer this. There's where we come on that day, talk about the myth. But please pay a premium to put a premium to your health. Check regularly for young people, if there's a familiar history, 35 years. When I say familiar history, it means somebody from the family already had the cancer of the prostate from 35 years. Otherwise, from 40 years. Men, guys, if you are out there listening and you have never, ever done screening before, please thank the physicians and go and do your screening. Till next time, my name is Dr. Martina Agbere. Stay blessed.
Thank you so much, Dr. Iwuji. This was very conversational, and I truly learned from it, and I'm sure our viewers out there, you've learned a lot today on prostate cancer. Please do us a favor. If you are a woman and you definitely have men in your life, your dad, your brother, your husband, colleagues, let them, anytime they go for their medical checks, as men, they should also ensure that they screen for prostate cancer, because you never can tell. The young man I talked about earlier on didn't know that the uncle died from prostate cancer, so it just didn't make sense that at that young age he had cancer. So you can have it. But from what Dr. Iwuji told us, curability, we are not saying treatability, means you can be cured from cancer if it is caught very early.
Nice and early.
No, very early, 98, 99%. My name still remains Dr. Memuna Yusuf Kadri, and please will be so happy if you follow us on all our social media pages, from Twitter or X Space to Trend to Instagram to Facebook to LinkedIn, and of course YouTube. If you've ever missed any of our program, go binge on almost 300 videos right there where you have the right information, in as much as we want to present to you misinformation and disinformation, reduce misinformation and disinformation. It's also good for you to subscribe and stay tuned with us every Saturday by 7:30 p.m. West African time on DSTV channel 369. Till next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.